Um, it- as a population, what are your thoughts about cell ed supporting us really as the boomers and this older generation get to a place where they need a lot more personal health support. They might need more technology support.
Yeah.
Um, there might be other life skills that, as we live longer and tech gets more complex, I just think about the wave that's coming. Can you talk a little more about if there's any programs that you've used specifically around that population?
I think we were very lucky under COVID-19 to be a COVID-19 responder because one of the hardest hit communities were folks that were at home without anybody to come and support them. So folks over 65. And so one of our programs was, all right, folks, they have a phone, but do they know how to use it in ways that you would imagine? And so we had a project across 20 hospital systems, and it averaged folks between about 77 were in the program. So
Wow.
anywhere
Okay.
and up to as old as in their 90s. So it was, all right, how are we going to make sure to reach engage? And everybody assumes that folks who are older can't navigate micro learning, mobile learning over a device. In fact, it's like any user. If it's accessible, easy to understand, and you aren't alone, if you have a question, it's surprising how quick people adapt and learn. So that was our best lesson learned, that our super users can be in their 90s. And
I love that.
yeah, and that it really is that if they're stuck, and we heard from Delia, right? The hardest is to download the app could be one of the barriers. And if you can make that easier, or if you need to get in through phone call first to get those steps, or to make it so much easier even to have access, start there. But then is it relevant to me? You need to answer that pretty quickly. And then if it
Mm,
is, do I see some over time, benefits over time? And I think that's important for any age. So yeah, we were very
of
fortunate to be able
course.
to work on projects which kind of took us out of our usual working adult age group to, okay, this is for young and old. And more
Mm,
increasingly families. We are starting to see the more demands for family access and use, which is also understandable.
yes, yes. I love that. I think we'll see more populations like that coming in to need specific like niche support or help given some current condition.
Yeah, and I think my
Um,
goal is that they get what they need quickly. Like we don't need to waste time. It's not about that they spend 200 hours on something. Did they get that question answered?